See, now the topic is Parkinson disease drugs. Now the topic is Parkinson's disease drugs. Okay, first L-DOPA is there. Okay, if we have given the L-DOPA, that is levodopa, in the peripheral region, that can be converted into 3-OMD, that is 3-orthomethyl dopa, that can be converted into 3-orthomethyl dopa in the peripheral region in the presence of enzyme 𝘂𝐿 𝘾𝙀𝙎𝙎 transferase. Again, the same levodopa that can be converted into dopamine in the presence of enzyme 𝘂𝙂𝙎. Okay. Now whatever that dopamine is there in the peripheral region, that dopamine that will interact with heart, that will interact with beta 1 receptor located on the heart, thereby it will causes tachycardia and palpitation. Okay, the same dopamine it will interact with beta 2 receptor present on blood vessel, thereby it will causes post-ural hypotension. Along with that, the levodopa, okay, the levodopa that will entered into the brain, okay, with the help of amino acid transporter. So this is a amino acid transporter. Okay, once there is a opening of amino acid transporter, then levodopa that can be carried into the brain, that can be entered into the brain. Okay, after entering into the brain, levodopa after entering into the brain, it can be converted into dopamine. It can be converted into dopamine. Again, the dopamine that can be converted into dopac, that is dihydroxyphenylacetic acid, that is dopac, in the presence of enzyme 𝘂𝐿𝙄𝙎. Again, the same dopamine that can be converted into 3-MT, 3-methoxytyramine, in the presence of enzyme 𝘂𝐿𝑚T, 𝘾𝙀𝙎𝙎 transferase. Along with that, the dopamine also interacts with D2 receptor located on the basal ganglia, thereby it will relieve the Parkinson symptoms. Thereby it will relieve the Parkinson symptoms. Okay, some of the drugs are there. Okay, some of the drugs that will directly interact with D2 receptor located on the basal ganglia, that is pramipixole and ropinirole, that will interact with D2 receptor, thereby relieves the Parkinson symptoms. Other drug is there, that is bromocriptine and pergolide, that is also directly interact with the D2 receptor located on the basal ganglia, thereby relieves the Parkinson symptoms. Okay, now these different enzymes are there, that is 𝘂𝐿𝑚T, dopa decarboxylase, okay, 𝘂𝐿𝐵 and 𝘂𝐿MT. See, these all enzymes are responsible for the metabolism of dopamine. So once the metabolism of dopamine will be there, then what will happen? So decreased concentration of dopamine in the brain it will be there. Okay, the Parkinson disease is majorly due to deficiency of the dopamine. So we need to increase the level of dopamine in the Parkinson's, so we can inhibit these different enzymes. Okay, we can inhibit this enzyme, so we can reduce the metabolism of levodopa, thereby we can increase the dopamine concentration in brain. See, what are the different drugs? See, psilocybin and rasagiline, these are the drugs that will act centrally and that will inhibit the 𝘂𝐿𝐵 enzyme in the brain. Okay, next, 𝘿𝐾𝙀 is a drug that will inhibit the 𝘂𝐿𝑚T that can be located in the brain. Next, entacapone and 𝘿𝐾𝙀 that will inhibit the 𝘾𝙀𝙎𝙎 transferase enzyme present in the peripheral region, that is present in the peripheral region. Okay, along with carbidopa that will inhibit the enzyme dopa decarboxylase that can be located in the peripheral region. Okay, this is about different drugs can be used in the Parkinson disease.